Okay, so we're going to be placing an NG tube today, and this is the equipment you're going to need to provide. You're obviously going to want the NG tube. In this case, we're going to be inserting a dual lumen Salem sump, 14 French. You're going to want a towel to put on the patient's chest just to protect him from any boogers and whatever. You're going to need a measuring tape to measure the length of your NG and then measure what's on the outside of the body. I'll show you when I get in there. You're going to want an irrigation tray with a 60 to 70 cc piston syringe. Looks like this and this. And we're going to use that to verify placement of the NG tube by withdrawing gastric contents. Here's some saline in case we need to irrigate for some reason. Gloves, of course. You're going to want tape, paper tape, that you're going to attach the NG to his nose. You're also going to use a little bit of tape and a safety pin to attach the NG to his gown. A blah 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 tongue depressor that you're going to use. You may need to use in case he's gagging a whole lot, or if it gets coiled up in the back of his throat, or you can't tell where it's going. You might want to look around in there. Which also means you need to have a pen light or small flashlight to look in the back of the throat. I always bring in a pen so I can take notes if I need to, mark the measurement of the NG tube location. These are tissues for purposes of this lab. I bring in a little box of tissues if he doesn't have any already. It kind of can make your eyes water, make your nose run or bleed a little bit, so I hand him some tissues. I have my lubricating jelly for the end of the NG tube. The connector that you're going to need, it doesn't come in the NG kit and it doesn't attach to the wall section, so you're going to want that. And then I'm carrying it all with this emesis basin that I will also hand to the patient in case he feels a little nauseous during this procedure or needs to vomit. I'll be ready. Gloves, if I didn't mention it, always gloves. Some water, a small cup of water, and a straw. Sometimes it helps them to swallow the tube down. And then always your stethoscope. I'm going to listen to his lungs beforehand just to make sure they're clear. And I'm going to listen for bowel sounds and document that as well.